Hi, everyone. So, are you guys going over cancer at the moment or the heart?
Cancer.
Cancer?
Mm-hmm.
And your quiz, have you taken it already?
No, I think a lot of us have it tomorrow or Friday.
Oh, okay.
Mm-hmm.
I see. Do you have any question on regarding cancer? Let me record this. It's recording. Okay. Does anyone have any question on cancer?
I don't have anything specific, but my question is, what would you suggest to focus on? Is it like more of the physiological parts of it, or or is it like knowing the different types of it in general?
So the big takeaway with cancer is knowing the that patient with cancer will need some kind of chemotherapy, and with chemotherapy, there are symptoms that you can help the patient by, like, let's say with chemotherapy, it's going to make the patient very nauseous, so you would want to administer an antiemetic medication, like an anti-nausing medication. Is that something, does that help?
Yeah, that's perfect.
Okay, so I also remember that with cancer, they like to test you on like the type of cancer as well. So like with skin cancer, what are the things that you need to look out for? Like what are you going to tell the patient when they come home and they see like a patch of like pigmentation on their skin? What are some signs that they should know to report to the doctor? Have you guys gone over that?
Maybe like irregular borders of moles that they may see like on their body, but they don't seem normal.
Yeah, so there's a it's called an ABCDE system. So A stands for asymmetry, B stands for border, C stands for color, D is diameter, and E is evolving. There's always like a select all that apply question on this. So I think it's really important to know this. And then do you guys have any other question? Like, do you have any specific question that you want me to go over?
Maybe like the medications that are important to know, I guess. I know that I have Professor Lim, and she was talking about the hemoglobin in one of our tutoring sessions, but I got confused on the medication. She was saying something about the hemoglobin being greater than 12. And if it is, you need to hold the medication and contact the provider. But I don't really know specifically what medication that was, if she was talking about most of the cancer meds or if it was a specific one.
Okay, so with cancer, with chemotherapy, it kills a lot of the good cells, the bad cells and the good cells. So you're like your white blood cells, you're going to have, the patient is going to have very diminished white blood cells. So you have to look out for signs of infection. So they're at risk for infection because of the low white blood cells, and they're also at risk for bleeding because of the low in platelet. So pretty much a lot of their white blood, their complete blood count, a lot of like their hemoglobin, their hematocrit, their white blood cell, platelet, all of that is going to be diminished because of the chemotherapy. A lot of time they will ask you like if the patient is getting chemotherapy and their white blood cells are now very low, what should you be looking out for in terms of like what should they like they have you guys went over like neutropenic precaution?
Yeah, we have.
Yeah, so there's always a question on that, I remember, on neutropenic precaution, like what can the patient have and what they don't have in terms of food. Can they have like fruits and vegetables?
No.
Yeah, they
I know
can't.
raw fruits and veggies you should tell them to avoid.
Yeah.
And also, like, if visitors bring like flowers into the room.
Mhm. Because that increases their chance of getting an infection. Also, when you're taking care of a patient who is neutropenic, who's in neutropenic precaution, you have to make sure that you wear a mask, and the patient also has to wear a mask, because when you come in close contact with the patient, you know how like when you speak, there's like fluid in the air. It'll help decrease the chance of them intaking that fluid if they wear a mask. I remember there was a question that was like asking if a nurse is taking care of a patient who's in neutropenic precaution, what before she enters the room, what should she have on? And that was like you should have on your gloves, your mask, and a mask for the patient. What else? Oh, with drug, there do you want to know like specifically about the type of chemotherapy drugs, or like just drug for cancer in general?
I guess the drugs for cancer.
Okay.
Yeah.
Is there a specific drug that you already know that you want to go over?
I guess I know that like Neupogen is given if the patient has neutropenia, and there's certain like guidelines that you have to follow before you can actually administer it. So I know that if the count is below 2,000, we want to put the patient on neutropenic precautions. And if it is normal or close to normal, we need to contact the provider and hold the med. Yeah, that's all I think I know about that one.
Does your instructor provide like a study guide for you guys?
No, not really.
No, not Professor Lim.
Yeah.
Yeah, my friend who had Professor Lim, she didn't do so well. I had Professor Roses, but she doesn't teach intermediate message anymore. She teaches intro now.
Sorry, who was your instructor?
I had Professor Roses and Professor Khan. They were Professor Khan was kind of like a professor, like an assistant for her. Professor Khan wasn't she didn't teach before, so she was just trying to gain experience. But now this term, I heard that Professor Khan teaches intermediate message now. So
Oh, do you know how,
she's my favorite instructor.
do
She
you know how
sings
her test is?
Professor Ahu
Professor
for,
Khan.
for Khan.
Yes.
For Khan, you want to make sure that you re-listen to the lecture, because most of the time she'll point out like what's going to be on the quiz. And yeah, she really does. Like if you re-listen to her lecture, you see, and also in her PowerPoint, like there's going to be like the important information is always bolded, so you want to make sure you know those.
Okay, so it's better I just read mostly from her PowerPoint.
Yes, her PowerPoint are very helpful.
Okay, and her lecture, read from her lecture, whatever she was.
Yeah, rewatch her lecture, because like yeah, you attend her lecture, but when you rewatch it the second time, it's very helpful,
I see.
because you pick up things that you like not noticed before.
Mm-hmm.
Yeah, I love Professor Khan. She's very helpful, and her teaching is very good.
Yeah.
I'm trying to find some medication for cancer so that we can go over it, but I don't see any. Let's see my notes. So you have Professor Khan?
Yes.
Mhm.
That's why I was asking how her test is. So
Yeah,
her
it's
test.
gonna be an easy class if you just listen to what she says.
Okay. I hope so. And then
You guys have, sorry, go ahead.
Her test, it doesn't come from those ATI questions from those from.
Yes, if you go to NCLEX workshop, those questions are helpful, because they help you like apply your knowledge on, and like give you practice. And sometimes you see like a question or two, I think.
I see. Great. Thank you.
You're welcome.
And did you read the book also for Professor Khan?
So I focus on the ATI book because I find that to be more precise. But I do recommend that whenever the ATI book doesn't help, you should refer back to your intermediate message textbook.
I see.
Yeah. But most of the time, I didn't find the need to, because I find that the ATI book can help explain things very well.
Uh-huh.
Mm-hmm.
Okay, great.
For Professor, yeah, I read the ATI book for Professor Khan and Professor Rose's. So, do you know signs and symptoms of potential infection or infection? Do you guys, okay, yeah, know that, because that's the main symptoms that the patient is going to have if they have like an infection. And then, do you know the difference between hospice care and palliative care? Do you guys remember the difference between hospice and palliative care?
I do not.
Mm-hmm. So let's say if a patient has a terminal illness, like if they have cancer, would they be in, if they have, where am I trying to go with this? If they have, like let's say with hospice care, yes, it's for, if they have like a really short time left, right? But with palliative care,
For chronic.
what can the patient get out of it? Pain management. And also to help relieve symptoms, like if they have dyspnea.
Palliative is for like the quality of life, I think, right?
Yes, like it helps with their, yeah.
Sorry, so is palliative is not is mostly is for chronic pain, but hospice is for dying soon, or in
Mm-hmm.
months they can die.
Yeah.
Oh, okay. Thank you.
Okay. Okay, with a patient who is going chemotherapy, their weight, it's gonna be. Can you guys hear me? My internet connection. Okay. So with patient who are on going. Hello? What was it? So with patients who are undergoing chemotherapy, they're going to have, because of all the nauseous and the fatigue that they feel, they won't have an appetite, right? So their albumin is going to decrease. So what kind of food do you think patient who is going undergoing chemotherapy should eat? And what should they? What kind of macronutrients should they have? Yes, protein. Do you guys know the 7 warnings of cancer? So the 7 warnings are, first is change in bowel or bladder habits. Second is a sore that doesn't heal. Third is unusual. Would it be better? Should I write it down? Guys? Okay. So, change in bowel or bladder. A sore that doesn't heal. Slow. Maybe I shouldn't have said that. So that doesn't heal. Unusual bleeding.
And these are, sorry, these are the 7 signs of, what did you say?
These are the 7 warning signs of cancer. Thickening, or lump in the breast or anywhere. digestion, or difficulty swallowing. Obvious change or nagging cough. I'm sorry, guys.
Come here, baby. Come here. Come here, Cookie.
The one, so if you have nagging cough or hoarseness, what kind of cancer do you guys think it might be?
Esophageal.
What was it?
Esophageal. Sorry.
No, it's okay. It's laryngeal cancer. Laryngeal. No problem.
Sorry, can you repeat your question for laryngeal cancer? What was the question, please?
Yes. So if a patient has laryngeal cancer, what would you likely see in the patient? Like you hear them, you see them, they'll communicate to you that they'll have like a nagging cough or hoarseness when they talk. Have you guys gone over debulking procedure? Do you want to go over that? Oh, let's go over screening because there's always going to be a screening. Adults above sorry guys, I have really bad internet connection.
That's okay.
What was I saying? Oh yeah, so adults above 50 and above 50 years old and older, what should they get screened?
Colorectomy?
Colonoscopy.
Colonoscopy. Yeah.
Yeah, so they get it screened, and then if they are at risk, like let's say if they have like a family history, then they come in more often. I think it's 5 years, but don't quote me on that. And then if they don't have if they're not at risk, then they come back every 10 years. And also now they have this sigmoidoscopy. So they look at the sigmoid section of the colon, and that sigmoidoscopy is done every 5 years. I think I remember seeing a question on that.
So it's every 5 years if they're at risk. And
Yeah. How does Professor Lim teach?
He
goes,
just reads the PowerPoint the whole
Really?
time.
That's
Yeah.
and
It's
reads very fast.
frustrating.
And she's what? She's shady?
No, very fast.
Oh.
I thought she was super fast.
She didn't really like interact with us that much, or like, I don't know. She was just reading us the PowerPoint.
Oh, I see. Does she provide like office hour?
I think so.
Yeah.
Yeah.
Go use that, because I find that to be very helpful when you reach out to like professor and ask them like specific question that you are confused, and sometimes they'll like sneak in, stuff here and there.
It's just, for me, it's hard to know what I'm confused with because she goes so fast. And I think her office hours are right after class. So I really don't know what to ask exactly.
Yeah.
Besides, what are you going to put on the test,
Do you guys read the textbook or the ATI book besides the PowerPoint?
I try. She really references the Lewis book in her syllabus, so I'm not sure. I'm going to try that for the first quiz, and if it doesn't go well, then I'm going to go towards the ATI.
Yeah. Did Professor Lim go over anything that you were like not too sure about, that you might want to talk about it here?
Well, she mentioned, like Lauren was asking, she mentioned a lot of the drugs, and I heard that one of my friends who took her last term, she focused on a lot on the I think there's a section in ATI that is called pathophysiology, EV pathophysiology, something like that, and it has a list of all of these drugs that we should know, but there's like a lot of them on there. And I haven't had a chance to look at those, but I mean, she just mentioned that section and she didn't really go over it, I guess, while she was lecturing. Or maybe she did, but I missed it.
I see. I just saw one drug here. So yeah, this is cancer. So with cancer, I previously mentioned that with cancer, a lot of their blood count, it's gonna go down. So like their red blood cells. A medication that they administer is etoposide alpha. Are you familiar with that medication? Do you guys know that medication?
I'm not. I haven't seen that written down anywhere. I see the filgrastim I have in my notes. Can you repeat what it's called?
Yeah, I also typed it in the
Oh, I
chat as well.
sorry.
It helps to increase their red blood cells. Yeah. I wish I have like the PowerPoint so that like we can go down the lecture. Procreate.
Yeah, now that I asked that question earlier about, remember I was saying anytime the hemoglobin is greater than 12, we hold the medication. That's for Arnisip, Procrit, and Epigen. Those are the 3 meds she was talking about, guys. So that's what that's in relation to. I just confirmed that like 2 seconds ago.
Okay. Yeah, so I noticed that if a professor like keeps talking about like a medication or something, then she probably is trying to tell you like to know that because that's going to be on the quiz or the final. So remember that, guys. Oh, let's go over. I think she said hold it if the patient has a white hemoglobin less than 12%. Is that what you said?
Oh, sorry. So anytime the hemoglobin is greater than 12, you need to hold the medication or contact the provider. Yeah, so we won't give those 3 medications if the hemoglobin is greater than 12.
Do you guys want to go over thrombocytopenia? So what do you know about thrombocytopenia? What does it mean? So what is the patient going to have? Like what symptoms are they going to have?
It will be bleeding from the gum.
What else? So if the patient has thrombocytopenia, then that means their platelets is below 10,000. No, 10,000. Yeah, 10,000. They're going to have ecchymosis. They're going to have petechia, bleeding in the of the gums, nosebleeds, blood in stools, urine, or their emesis. What causes bleeding in the GI? What medication causes bleeding in the yeah? So if a patient has wait, this is no, this is not even cancer. Okay, never mind. Let me go through my notes, see if I forgot anything. I remember that the NCLEX review workshop, the practice questions were very similar to the ones that were tested. So do a lot of those practice questions, guys.
I've heard a lot about that too.
Yeah. For week 1 specifically, week 1 and lungs. Have you guys gone over that? Do you wanna do like practice questions? Let me see. When is the NCLEX workshop for you guys? It was today. Earlier? Were you guys able to go through the whole list? Oh no. We can go over it, guys. I have I don't know if it still show me. Oh, what? I'm trying to pull up the questions so we can practice. It's not loading. Oh, guys, I need you guys to check in. How do I share my screen? Share screen. Oh, there's white one. Can you guys see my screen? Can you guys check in, please? How do I go to chat again? Are you guys able to see my screen? Can you guys hear me?
Yes, but it says
Yes, we could hear you.
anatomy.
Okay, great. Can you see my screen?
Yes,
Yeah, but it says anatomy for that code.
It's anatomy. What? Okay, let me. What? It says intermediate. Okay. How do I? Stop share. Okay, I'm gonna. Give me 1 second. Okay, try this one. Anatomy, huh? They probably sent me the wrong one. Yeah, they sent me the wrong one, guys. Let me just.
yeah, it still says anatomy,
Yeah.
but I can still sign in if you want.
I'll take a screenshot of everyone who's here. It's okay. I don't think you have to sign in for this one because that's not the right one. Okay, let's do some. Do you guys want to do some practice questions? Cancer. Okay. Are you guys able to see my screen?
Yes, we can see it.
How are your online classes experience? You guys? Okay. A nurse is caring for a client who is receiving radiation therapy to treat lung cancer. Which of the following actions should the nurse take? Review laboratory tests, a result for low hemoglobin, observe signs for infection, monitor mouth for signs of xerostomia, examine the skin of generalized urticaria. Radiation for what do you guys think the answer is?
It's B.
B?
Yeah.
Radiation therapy to contain bone marrow, such as the sternum, can lower white blood cell count, leukopenia, thus increasing the client risk for infection. Yeah. Okay. A nurse is teaching a client about 7 warnings, signs of cancer. Remember this? Which of the following signs should the nurse include as a manifestation of cancer? Which one was it?
A, C,
A,
D,
C,
yeah,
what else?
D, and
D.
E.
This one. Okay. So a non-healing sore. A nurse is teaching a group of middle adult clients about early detection of colorectal cancer. The nurse should include the American Society recommendation that men and women beginning at age 50 who are at average risk should have a fetal occult blood test and a colonoscopy at which of the following intervals?
10 years.
B, 10
Yeah.
years.
Yay. Okay. Do you guys want to look at the explanation or nah? Do you need to?
If we get it wrong, I think I would.
I agree. Okay, a nurse is admitting a client who is about to undergo surgery for benign prostatic hypertrophy. The client states, I don't know what I will do if they find that I have cancer and find I have cancer. Which of the following responses should the nurse make? Why do you think you might have cancer when your diagnosis is benign? I'm looking at your chart here. I don't see any reason for you to be worrying about that. I think that's something you need to discuss with your provider. I'm hearing that you are concerned that it might turn out that you have cancer.
Is it A?
No, because you shouldn't ask question that begins with why. Because when you ask why questions, it causes like a confrontation.
Yeah, this why is not a why question. Is it was another question. It was started with a why, and it was similar to this question. It was just concerning. It wasn't the why question.
It's actually this one though.
Oh, is this one?
Because when you're saying that, I'm hearing that you are concerned that it might turn out that you have cancer. It's more of like you're expressing your concern, and this one it's more of like why do you think that you have cancer? It's kind of confrontation, and it might cause the patient to go like, oh, maybe I shouldn't say anything else.
You always restate what they said in a question.
Yeah. So this response illustrates a non-therapeutic communication technique of requesting an explanation. Asking why questions can be intimidating, and it might cause the client to become defensive. Is that clear? Was that helpful?
Yes.
Yeah, so this one is therapeutic. Yeah, always like repeat the patient in another way. That's usually the answer. A nurse is preparing a teaching plan for a client who has neutropenia as a result of radiation therapy for the treatment of lung cancer. Which of the following should the nurse plan to include in the teaching? Okay, so they're getting radiation therapy. So what is that going to do? That's going to lower their white blood cells, so they're at a high risk for infection. Which of this do you think it would be? Their neutropenia.
A.
A, yeah.
A.
A nurse in a dermatologist office is planning an educational session about skin cancer. Which of the following should the nurse include as risk factor for skin cancer? So the lighter skin that you have, the higher risk of you getting skin cancer. So this is not it. Under the age of 40, no. the older you are, the higher risk of skin cancer, because your skin are now very sensitive. So overexposure, previous skin injury, and genetic. Yeah, guys, do you agree?
Yes. But by previous skin injury, that could be like any scab, anything.
Yeah, because then that spot is now like at risk for like damage.
Oh, okay.
So if you're 60 and older, if you're 60 and older, you have higher risk of getting skin cancer, and light skin are more prone. A nurse is caring for a client who is receiving this medication, cisplatin, to treat bladder cancer. After several treatments, the client reports fatigue. Okay, which of the following actions should the nurse take? Their fatigue. What? Okay. Check the result of the client most recent complete blood count. Assess the client for a hypersensitive reaction. Evaluate the client for hypercalcemia. Examine the client for hepatomegaly. So what can cause fatigueness? If they have bladder cancer, what's their treatment? It's gonna be like either radiation or chemotherapy, or maybe even both, right? And with chemotherapy, it causes the patient to have really low blood count, so that if they have low blood count, they're gonna feel fatigue because their cells are not
Is it A?
yeah, it's A because their blood count helps their red blood cells help deliver like nutrients, oxygen. If their red blood cells are diminished, are they going to be getting the nutrients that they need? No, right? So that's why they feel fatigue. So the answer would be check the blood count, the complete blood count. So the client might have anemia as a result of myelosuppression. Yeah, so from chemotherapies. If so, she might require treatment for anemia, transfusion, medication, and the provider might have to delay further chemotherapy until her blood counts are higher. A nurse is caring for a client who has prostate cancer. The nurse should expect the provider to prescribe which of the following medication for this client? Prostate cancer. Which one do you guys think it is?
Is that tamoxifen?
What was it?
Tamoxifen? D?
D?
I'm not sure though.
I think it's A. I could be wrong.
D is for breast cancer.
Yeah.
That's for breast cancer. Yeah.
It's breast cancer. I think it's A. Yeah. Leuprolide treats cancer of the prostate hormonally. There you go.
Sorry, this question is from, where is this question is from?
This question is from NCLEX workshop.
Oh, I see. Thank you.
Yeah. A nurse is leading a group therapy session for clients who are newly diagnosed with cancer. Which of the following statements should the nurse make? Newly diagnosed with cancer. So antidepressants are not your solution, but this group therapy is. That's kind of that's not therapeutic, I don't think. I notice you keep clenching your fist. This needs to stop. That's not therapeutic either. You need to work hard on resolving conflict with those closest to you. that's not good. Let's discuss what you mean when you say that you cannot ever return to work. Which one do you guys think?
The last one, because she's pretty much repeating.
Yeah. Okay, so this example is clarification, which is therapeutic. Clarification asks the group member to expand and clarify what he or she means so as to create a better understanding during the group session. A nurse is preparing a client who is receiving chemotherapy for treatment of ovarian cancer. Which of the following actions should the nurse plan to take? Tell a client to expect dark stool following chemotherapy. Do you guys remember? Oh, do you know ovarian cancer? So cancer of the ovaries. Mm-hmm. Okay, what is the main problem here? Okay, they're getting chemotherapy. What action should they take? So with chemotherapy, remember that it causes nauseousness, right? Or nausea. Nauseousness. Nausea. So what are you going to pick? It's going to be this one, because this is a medication to help prevent nausea. A nurse is caring for a client who has metastatic bone cancer. The client states, "I want to go home to die." The family is concerned about meeting the client care needs at home. Which of the following actions should the nurse take? Discuss initial hospice care with client and family. Write a referral to place the client in a nursing home. Talk with the provider about extending the client's stay. Inform the client family that they are responsible for providing palliative care. That's not right. So which one do you guys think it is?
Maybe A.
I think so. Right.
Yeah, they probably want to talk about it.
Yeah, it's you. If the patient if they resolve the problem, they need the bed, so they're not gonna extend the client's hospital stay because the family is concerned about the client's needs at home. They're not gonna do that. So I think it is A. The nurse should discuss the availability of resources that can assist with the care of the client. Home health and hospice care are both resources that can provide support for care of a client at home. A nurse is providing an educational program about dietary interventions to reduce the risk of prostate cancer. Which of the following information should the nurse include? So food that reduce the risk of prostate cancer would be increasing animal fat, increasing fatty fish, reducing dietary fiber, or increasing carb. It's not going to be
Maybe.
What was it? What was it?
I don't know. It wouldn't be fish though, right?
I think it is fish because omega-6. You don't want to reduce fiber because you need fiber to prevent like colon cancer. You need carb. Oh wait, you don't need complex carb. You need simple carb. And increasing animal fat can increase your cholesterol. So fatty fish because it has omega-6. or omega-3.
So magnesium wouldn't affect. Magnesium in fish wouldn't affect or wouldn't like affect our chances with prostate cancer.
I don't know whether magnesium affects the prostate. I'm not sure.
Okay.
Yeah.
Okay.
A nurse in a provider clinic is assessing a client who has cancer and a prescription for methotrexate (PO). Which of the following actions should the nurse take when the client reports bleeding gum? Explain to the client that this is an expected adverse effect. Check the value of the client current platelet count. Instruct the client to use an electric toothbrush. Have the client make an appointment to see a dentist. So the question is asking, so patient has cancer and is prescribed this medication, methotrexate. What action should the nurse do when the client reports bleeding gums? Is this an adverse effect of this medication?
No.
No, right?
No. It's going to be B, I think.
D?
No, B as in boy.
B, yeah. This is one. And you're not supposed to use this because this can cause increase in bleeding. So yeah. A nurse is providing teaching to a client who has breast cancer and about the adverse effects of chemotherapy. Which of the following client statements indicate an understanding of this teaching, I will take antiemetic as soon as the chemotherapy infusion is complete. No. I will run my toothbrush in the dishwasher every month. No. I will call my doctor if I notice any unusual menstrual bleeding. I will avoid crowds to keep from infecting others. So they have breast cancer. They had chemotherapy. D?
C as in cat.
C? Yes. Yeah. A nurse is caring for a client who has been diagnosed with end-stage liver cancer. Which of the following responses is an indication that the client is in a denial phase of the grief process? Doctor has been so good to me. I know he has tried everything he can. It's just my time. I can't believe the doctor graduated from medical school. He doesn't know a thing about treating cancer. Doctor says I only have a few months to live, but I know he is exaggerating to get me to take my medication. Even though I'm not hurting right now, I don't feel like I have the energy to get out of bed. So they're in denial phase. Which one of this is denial phase?
C.
Mm-hmm. A nurse is teaching about adverse effects of anastrozole with a client who has advanced breast cancer and is post-menopausal. Which of the following adverse effects should the nurse recommend the client to report to the provider? So
A.
they have, what was it?
A.
A?
Yeah, weight gain. Oh.
It's this one. So the client is experiencing musculoskeletal pain, should notify the provider. Yeah, because that means yes. Or it's because of estrogen deprivation, breast cancer. I was thinking that if they have advanced breast cancer, that means that the cancer has now traveled towards their bone, and that can cause pain in this region, the bone area.
Yeah, but I was thinking about the postmenopausal.
Mm-hmm.
Usually they gaining weight after postmenopausal. What is it to do with the muscle skeletal pain?
So yeah, postmenopausal, the client might gain weight, but they have cancer and they're probably going through chemotherapy. So their weight gain is probably not going to be as much. Like if anything, I think they'll lose weight.
So musculoskeletal pain is an adverse effect of the cancer or of the anastrozole?
Musculoskeletal pain. It says musculoskeletal pain is a common adverse effect that affects 50% of clients that is possibly caused by estrogen deprivation. Yeah, so it says it is an adverse effects of this medication.
Okay.
Mhm. A nurse is caring for a client scheduled to receive external radiation to the neck for cancer of the larynx. During a pre-treatment exam, the nurse explained to the client that the most likely side effect would be infertility, diarrhea, dyspnea, and dysphagia. So cancer of the neck.
Dysphagia
Mm-hmm.
or
It's going to be dysphagia. Difficulty difficulty swallowing because they're getting radiation at like their throat, so swallowing is going to be difficult. So the only area of treatment is affected by radiation. So dyspnea, shortness of breath may occur radiation. Oh yeah, so this would only occur if the radiation is at the chest or the breast. A client is receiving treatment for stage 4 ovarian cancer and asked the nurse to discuss her prognosis. The client plans to have aggressive surgical, radiation, and chemotherapy treatments. Which of the following prognosis should the nurse discuss with the client? Good, card, poor, very good. So they have stage 4 cancer. Stage 4 is the last stage of cancer. So what do you think the prognosis will be?
It will be poor.
A nurse is planning care for a client who is being treated with chemotherapy and radiation for metastatic breast cancer and who has neutropenia. The nurse should include which of the following restriction in the client plan of care. We went over this one. So all visitor from entering the client's room. Fresh flowers, potted plants in the room, oral fluid intake to between meals only, activities that could result in bleeding. So they have cancer, they're going through chemo and radiation for breast cancer, and they have neutropenia. What are you going to restrict out of these choices?
the fresh flowers?
Yeah. A hospice nurse is caring for a client who has terminal cancer and takes PO morphine for pain relief. The client reports that he had to increase the dose of morphine this week to obtain pain relief. Which of the following scenarios should the nurse document as the explanation for this situation? So they have terminal cancer, they're taking morphine for pain, and they have to increase the dose of morphine to obtain the pain relief. So what is the explanation to why they have to increase the dose Is it because the client is not taking the medication properly? The client is experiencing episodes of confusion. The client has become addicted to the medication, or the client has developed tolerance to the medication.
D.
Yeah. The nurse should document that the client has developed tolerance to this medication. Morphine is a narcotic analgesic. For the treatment of severe pain, tolerance is an adverse effect of narcotic analgesic in which a larger dose is needed to produce the same response.
Because we tried it.
A nurse is teaching a class at a community center to a group of adults and older adult client regarding regular screening recommendation for cancer prevention. Which of the following information should the nurse include? They should start yearly mammogram at age 30. Client should
When it doesn't work, it shouldn't be charging my cell phone right now.
No.
client should have a colonoscopy at age 40 and every year 10 years thereafter.
Shouldn't be.
Client should have a yearly test for a
It shouldn't be working.
This is the
one.
problem.
Yeah.
This may work, but it's not getting any power. So
Let me see.
Can we mute our microphone, please?
the
Women should have a yearly clinical breast examination starting at age 45. Which of these do you think it is?
I think it's A.
I think so too. So colonoscopy should start at 50, not 40. They should have a yearly test for fecal occult blood test. I kind of feel like it's this one. Women should have a yearly, no. Is it yearly mammogram at age? Yearly, no. Actually, it's actually every 3 years.
Mm.
Yeah, so
Because I think the colonoscopy starts at age 50, so then, okay.
But I think it's this one, but let's see. According to American Cancer Society, women should start yearly mammogram after age 40. 50. According to American Cancer Society, all clients should have yearly tests to test for, yeah. Okay, a nurse is reviewing the complete blood count, finding for a female client who is receiving combination chemotherapy for breast cancer. Which of the following findings should the nurse report to the provider? So they have breast cancer and they're going through chemotherapy, and they're the nurse is checking the client's blood count. Which one of this should you report? What platelet is normal, or what platelet at what range did I mention before that you start seeing bleeding? Do you guys remember? It was below 10,000, remember? And then it's what normal value is white blood cells.
I read that wrong. White blood cells over 10,000 is a sign of infection.
Over.
So it's D, like you said.
It's what, D?
Yeah, because white blood cells over 10,000 is a sign of infection. So right there, it's only 2,300.
Yeah, but from what to their normal white blood cells should be from 5,000 to 10,000. If anything below 5,000, then they have a very high chance of getting infection. So, if they have 2,300 of white blood cell, that's very low. So they're probably going to put this patient in neutropenia. But they needed to talk to the doctor before. So this one. Does that make sense? And platelet, it should be around. So bleeding will start around like 10,000, below 10,000. But for regular platelet, I think it's 150,000 to 300,000. I think that's the normal, but I could be wrong. Oh, it doesn't say. But yeah, it's this one because their white blood cell is very low. Remember this, I think I saw this question on the quiz.
Good to know.
A nurse is teaching a client who is receiving treatment for metastatic colorectal cancer about the adverse effects of bimazizumab. With the nurse should instruct the client to report which of the following finding as an adverse effect of this medication. So they have colorectal cancer and they're taking this medication, and the adverse of this medication is what in one of these? C?
Or I don't know, maybe weight gain, actually.
Weight gain, I think it might be nosebleed, but I could be wrong. Nosebleed. Yeah, so I guess this causes your blood to thin out. That's why you can get like nosebleeds or GI bleed, vaginal bleed, intracranial bleeding, pulmonary bleeding. Oh, it causes thrombocytopenia, so it causes your platelet count to decrease. A nurse is assessing a client who has a long history of smoking and is suspected of having laryngeal cancer. The nurse should anticipate that the client will report that her earliest manifestation was. So remember, laryngeal cancer?
Hoarseness.
Yeah. A nurse is caring for a client who asked to be screened for cervical cancer because a relative has been diagnosed with it. Which of the following tests should the nurse expect the provider to use? So, cervical cancer. What do we get at the doctor's office? Women.
Pap smear.
Yeah. So,
Cola.
I don't know why this word is Papani-Coli test. I like pap smear. Okay. A nurse is caring for a client who has been diagnosed with cancer of the colon. The client asked the nurse several questions about what the provider might be planning to do. Which of the following nursing responses should the nurse make? So they're diagnosed with colon cancer. They asked several questions to the nurse about what the provider is going to do, what the doctor is going to do, and then the nurse, which of the following responses are the nurse going to make? Provide the client with articles from the internet explaining colon cancer stages, but that's not what they asked, right? They asked, what is the doctor going to do? Assure the client that the provider will explain what has been planned, explain the various options available for treatment based on the cancer stage, encourage the client to write down questions to ask to the provider.
D.
What was it?
Either B as in boy or D as in David.
Yeah. So assure the client that the provider will explain.
Is it C?
No, it's actually D.
Oh, it's D.
Yeah, let's look at the explanation. So it's not B because this response by the nurse blocked communication by putting the client concern on hold and giving false reassurance. It's not C because it is not within the nurse scope of practice to discuss treatment options to the client. It's D because the nurse does not know the answer to the client's questions, so helping the client prepare questions to the provider to address the client's needs. A nurse is providing teaching to a client who has new diagnosis of testicular cancer. Which of the following information should the nurse include in the teaching? So they have testicular cancer. What should the nurse teach about this cancer? A close male relative are at an increase of developing testicular cancer.
B.
B. Testicular typically occurs around the age. Okay.
C.
After diagnosis.
And then the last one also.
The last one, a painful. So remember one of the 7 signs of cancer, one of it was that a lump is not painful. So, and then this one is painful. So it might not be this one. What else? I think
maybe
A.
close male relatives.
Yeah, this one for sure because it can be genetic. And then testicular cancer because okay, I don't know that one. Sperms no longer. Sperms are actually it depends on what stage of cancer you have. So just because you have been diagnosed with cancer, that doesn't mean that the sperm that were produced, that sperms are no longer viable. Does that make sense? Like it depends on what stage it is of the cancer for it to be affecting the sperm production. Does that make sense?
Yes.
Yeah, so I don't think it's that one. Yeah, and it doesn't it won't affect it equally. Like if it doesn't have to. It doesn't have to be. I think, yeah. Okay, so let's look at the painless scrotal swelling is an indication. Sperm might be absent or low in number, but remain viable after diagnosis. Testicular cancer is rarely bilateral. During a routine physical exam, a nurse observes a 1 centimeter lesion on the client's chest. The lesion is raised, flesh color with pearly white borders. The nurse should recognize that this finding is suggestive of which of the following type of skin cancer?
C.
Malignant melanoma? It's not C.
Then it would be carcinoma, I think.
Did you?
I could be wrong.
What did you say?
A.
I could.
Squamous cell carcinoma.
So the main information that you need to know is the pearly white borders, because that signifies this cancer.
That's not cancer.
Actinic keratosis. Oh, I guess not.
B. It was A or B.
So it is B, basal carcinoma. Usually small waxy nodule. Oh, pearly borders. Pearly borders. So basal cell carcinoma. Rough scaly. Okay. Do you want to read the explanation for the other ones? We have 30 minutes.
Yeah.
Questions. What was it?
I thought melanoma referred to the skin. And I thought melanoma
Oh,
referred
yeah,
to the
melanoma.
skin.
So with melanoma, they're going to have raised border, yeah. No, raised lesion. The border is not going to be pearly white. It's going to be like a multicolor.
Okay.
I wonder if this is in here. Yeah, often vary in color. A nurse is caring for a middle adult client who has just received diagnosis of endometrial cancer. In taking a nursing history, which of the following manifestation is likely to be reported by this client? So they have endometrial cancer, endometrium. What is the manifestation that they're likely gonna report? Unilateral swelling, extreme abdominal pain with intercourse, green and malodorous vaginal discharge, post-menopausal bleeding.
Is it B?
No. This could mean like a UTI or extreme abdominal pain. I don't know. It's actually this one, because if once you have your menopause stage, once you pass the menopause stage, then there shouldn't be any bleeding. But if you have bleeding, which is one of the signs for cancer, then it's indicative of cancer. So endometrial cancer involves cancerous growth in the endometrium lining, or the lining of the uterus. The most common manifestation of endometrial cancer is abnormal uterine bleeding, which include postmenopausal bleeding and bleeding between normal periods in premenopausal women. A nurse is caring for a client who has cancer and a new prescription for ondansetron to treat chemotherapy. Oh yeah, this is one of the anti-emetic medication. Ondansetron to treat chemotherapy-induced nausea. Which of the following adverse effects should the nurse monitor? Headache, edema, polyuria.
Headache.
I think so, yeah. Headache is common adverse effect of ondansetron. Analgesic relief is often required. A nurse is caring for a client who is dying of metastatic breast cancer. She has a prescription for an opioid pain medication, PRN. The nurse is concerned that administering a dose of pain medication may hasten the death of the client's death. Which of the following ethical principles should the nurse use to support the decision to not administer the medication? So the client is dying from breast cancer, and the opioid pain medication can increase the likelihood of the client to die. Which of the following ethical principles should the nurse use to support her decision not to administer the medication?
Fidelity?
Fidelity?
I'm not sure.
Yeah, let's go over it. So veracity, what is veracity? Veracity is to be to say the truth at all times. Like to tell the truth and nothing but the truth. Fidelity is I think fidelity is to
be faithful or loyal to them.
Yeah. And then non-maleficent, it's like to do no harm. If you're gonna give this medication, it's gonna increase their chance of dying. And you wanna do no harm by not giving the medication.
So it's B.
Mm-hmm. Non-maleficent is the duty not to do harm. The ethical mandate of non-maleficent is that healthcare workers refrain from intentionally inflicting harm to the clients. A nurse is caring for a client who has lung cancer and is scheduled for a lobectomy. The nurse should prepare the client to expect which of the following after the procedure. So they have lung cancer and they're gonna remove one of the lobes. What is the nurse going to prepare the client after the procedure, after the lobe has been removed? Would they need an sternal incision, a chest tube, pain medication, or are they gonna experience pain? Pulmonary function studies. So after you remove an organ or a piece of organ or anything in your body, there's going to be bleeding, there's going to be swelling, fluid. So how are you going to get rid of those fluid to facilitate in healing? You're going to need a chest tube to drain out the fluid, right? So a lobectomy is a major surgery that involves a large posterolateral or anterolateral incision into bone, muscle, and cartilage. Chest tube is placed to drain air and fluid and remain in place for several days after surgery. A nurse is providing teaching to a client who has a new prescription for tamoxifen to treat breast cancer. The nurse should include that which of the following is an adverse effect of this medication. Remember this medication, you guys? You said it was for breast cancer? So what is an adverse effect of this medication?
Pain.
Yes. A nurse is assessing a client who is to undergo a lobectomy, a left lobectomy to treat lung cancer. The client tells the nurse that she is scared and wishes she had never smoked. Which of the following response should the nurse make? What is therapeutic? Your doctor is a great surgeon. You will be fine. That's false reassurance, right? I understand your fears. I was a smoker too. That's too much information. Don't worry. The important thing is that you have now quit smoking. It's okay to feel scared. Let's talk about what you are afraid of. Don't worry. That's kind of like false reassurance also, right? What do you guys think it is?
A.
Yeah.
Let's talk about your fears.
A nurse is caring for a client who is receiving cisplatin for treatment of ovarian cancer. The client's most recent complete blood count is shown below. It is important for the nurse to consider which of the following for the client. So the white blood cells is at 1,400, guys. Is that high or low?
That's low.
Yeah, it's low. What should it be? Or what's the range that it should be in?
5 to 10,000.
Yes, 5,000 to 10,000. So that's low. That's okay. So the client is at risk for bleeding. The client's at risk. The client should receive a diet with increase in protein. The client has an increased risk of infection. The client should receive an erythropoiesis stimulating agent.
Increased risk of infection.
Yeah, it should be 5,000 to 10,000. A nurse on an oncology unit is preparing to administer doxorubicin To a client who has breast cancer, prior to beginning the infusion, the nurse should verify the client's current accumulative lifetime dose of the medication. For which of the following reason is this verification necessary? An excess amount of doxorubicin can lead to myelosuppression. Exceeding the lifetime accumulation dose limit doxorubicin might cause extravasation. An excess amount of doxorubicin can lead to cardiomyopathy. Cardiomyopathy. Exceeding the lifetime accumulation dose limit of doxorubicin might produce red tinge, urine, and sweat. Okay, so patient has breast cancer and the nurse is about to administer doxorubicin.
Maybe A.
An excess amount of doxorubicin. It's this one. So it's not A because a common and life-threatening adverse effects of doxorubicin to leukopenia and thrombocytopenia. Okay. So it's not A because myelosuppression means like it's common and life-threatening adverse effects. Okay. It's an anti-neoplastic antibiotic to treat various cancer, irreversible cardiomyopathy with congestive heart failure. Yeah. So this medication causes heart disease.
Okay. Doxorubicin.
Yeah. A nurse is providing teaching to a client about preventing skin cancer. Which of the following client statement indicate a need for further teaching?
Are you done?
No, I'm still teaching.
Oh, I'm hungry. Wanna go get pizza?
Okay, a nurse is providing teaching to a client about preventing cancer. What ways are they gonna do, what measures are they gonna do to prevent them from getting cancer? Eating high fiber to lower the risk of skin cancer? That's not it, right?
No.
High fiber can prevent what cancer?
B. Or D. Or C. I don't know.
But answer this question. Eating fiber can help prevent what cancer?
Colon?
Yeah. So I should check my skin monthly. Should you be checking your skin monthly or every day? Or every week, maybe?
Every month.
Every month? That's a little bit too far.
Every week.
Every hour. I should avoid the use of tanning boots. Okay. I should use sunscreen every day, even on cloudy days.
That's true.
So A.
This one, right? Why is it this one? Stop.
Because
Further teaching.
melanoma.
I think it should be A.
It should be A?
Yeah, because which one is saying which one it needs?
Oh, needs for further teaching. Yeah. yeah, you're right. Yeah, guys, I always get messed up with this, like, indicates for need for further.
That's me.
Ugh, I hate that. Yeah, you're right. It's this one. This one is wrong because this eating high fiber can help prevent colon cancer, not skin cancer. How long should you check your skin? Monthly. Oh, okay. Not every day. A nurse is caring for a client who has cancer and is receiving palliative care. Which of the following statement by the client indicate they understand this type of treatment? So they has cancer and they're receiving palliative care. I'm thinking of getting a second opinion. I'm hoping this will limit my discomfort. This treatment should help me live a little longer. This is not working. I plan to stop treatment. Which one of this means that they understand what palliative care stands for?
B.
A nurse is caring for a client who has advanced lung cancer. The client provider has recommended hospice service for the client. Which of the following statement by the client indicate a correct understanding of hospice care? I will have to be admitted to a long-term, no, hospice care is short-term. Oh no, wait, to a long-term care facility in order to receive hospice care. I should expect the hospice team to help me manage my dyspnea. Hospice care services are available to patients who are terminally ill regardless of their life expectancy. My oncologist will continue to look for a cure for my cancer while I'm receiving hospice care. Which one do you guys think it is?
It's not D.
It's not D, you're right. Why is it not D?
Because there's not going to be a cure for it anymore. That's not their goal anymore.
Yeah. It's not going to be C. Hospice care service are available to patients who are terminally ill regardless of their life expectancy. Hospice care can provide care for patients for 6 months. In order for them to be in hospice, to be able to apply to hospice care, they have to have a prognosis of less than 6 months to live. So it's not going to be their life regardless of their life expectancy. It's not going to be A because I will have to admit a long-term.
Is it B?
Yeah, it's B because it manages their symptoms. Dyspnea is a manifestation of terminal lung cancer. The primary purpose of hospice care is to provide relief of symptoms related to terminal illness. A nurse is providing teaching to a client who has cancer about foods that prevent protein, energy, and malnutrition. Which of the following foods should the nurse include in the teaching? Okay, so prevent protein, prevent low in albumin. What?
So, cottage cheese,
Cheese,
tuna fish,
tuna fish,
strawberries, bananas,
omelet.
yeah,
This
and
one?
eggs,
Yes.
And this one?
and strawberries and bananas.
Does this one have protein?
No. Strawberry and banana doesn't have any protein.
No, it doesn't have protein, right?
Why is it in my notes? Okay.
It has good fibers. Maybe strawberries, banana to as not to give the patient if they have like neutropenic concussion. What about milkshake? Does milk have?
Maybe because yogurt has protein, right?
Does milk have protein? Yeah, right.
Dairy.
So egg because egg has protein. Tuna because it's meat protein. Cottage cheese because yes.
So strawberries and bananas, you said they have fiber?
Yeah, it just has fiber. It doesn't have protein.
Good to know.
All right. Was that helpful, you guys?
Yes.
Yeah.
Very. for me.
Oh,
It's good to see you read it out loud and say what you're thinking of, because when I take the quizzes, I'm still having trouble with knowing and thinking about having the logic we should for taking these ACI.
they say that you should be doing 75 questions per day, like practice. That way it helps your mind like go straight to the point, like instead of you reading the whole thing, you know? Let me see if I have other ones. Let me see if I can share. Okay. I can't wait to cover like lungs and beyond. I hate cardiac, but I'll try to help you guys. See if I have any more codes. When are your tests? Tomorrow? Okay. Do you guys want to, like if you have any question, you can contact me. Do you want like my contact? Imagine no. Let's see, do I have any codes? I don't see any codes. My email is
Sorry, how do you pronounce your name?
oh, my name. It's Ni. It's a little bit hard to pronounce. Ni.
Ni?
Like Nini, but just Ni.
Ni. Okay.
Mm-hmm.
And that's your phone number, that's right?
Yeah, that's my phone number.
Thank you so much. I appreciate that.
You guys, if you guys want to want the access to the code, I think I have codes, but I don't remember where I put it. So if you want to text me, I will try to find it and send it to you.
Please, yes. I will send it to you right now.
Okay.
Is it the same code right now you were working with us, Ni?
This is the code from last term.
Oh, great. It was very, very helpful. I thought it was for...
That's so sad that they didn't give you guys a code for, you know, this week.
Yeah, this, let's see, I will...
Yeah, so I will try to find it and send it to you guys, okay?
Okay, so I will text you right now. And my name's Sepide. Nice to meet you.
Nice to meet you too. I wonder what we can do about the sign in. Guys, can we just sign in on the thing? Just like maybe if they can just change the name later, because I don't think it's different. Can we do that?
Yeah.
Okay. have any other question that you want me to like explain, I am happy to help you guys. So just let me know, email me, text me, whatever. I feel bad for those who have limb though, because limb is hard.
Really?
Yeah, that's what I heard from my friends.
Oh no. I've heard very different things from everyone. Some people told me she has the easiest quizzes.
Oh,
But
really?
but then someone yesterday told me that her quizzes are the hardest. And I originally had Balthazar, so I switched to Lim because she was the only other class that was open. But now I don't know if that was the best decision. Because I already had Balthazar for funds, and I struggled in that, but at least she knows me.
Yeah. Do you guys have any other question? Have you all signed in or checked in?
Yeah, I just signed in.
Okay. Thank you so much, guys.
Thank you.
Stop sharing. Not sure how to use the code to sign in. So basically you use your phone camera and you screen this code, and it'll give you a link, and you will click on that link and fill out the form. It's gonna look like this. It'll look like that. Let me see the comments. I'm not sure how to use. Are you able to use it, Valentine? Okay, perfect. Okay, guys. Stop share. Nice to meet everyone. Thank you for attending.
Thank you.
Thank you. Don't forget, please, the code. The one you put it in here. Is it the code you? Is it you were trying to give us? There is a username. Is it 167?
No, so what happens is when you input like a practice on ATI, it'll be there. It'll be there, so you don't have to like keep inputting it when you try to retake it. It'll be there in the test section. So I went on my, I just looked for cancer. So I didn't have to input the code or anything.
Oh, okay.
But I'll try to find the code and then I'll send it to you guys.
Thank you so much. I appreciate it. I already sent you my text, so.
Okay. Yeah, let me try to find the code. Any other question?
Who was your clinical instructor, by the way?
My clinical instructor for now?
No, yeah.
Last time I had Professor James. He was the best. I had clinical at Palliative.
Lucky you.
I know. I feel so bad for those who, you know, have like to do clinical online because you can't learn anything online.
I know. Well, the online is okay, but we had it with Sarkeesian.
Sarkeesian online?
Yeah, she's the toughest instructor. She just give us, 2 breaks. That's it, and then we have to work very hard.
Sorry. Yeah, Professor James, he was very kind. He was very helpful. He was very patient in helping you, like learn how to do IVs and stuff like that.
Mm. Well, what should I say? It's okay.
Okay, guys, it's 2 o'clock. Let's wrap things up. Any last minute question?
No, just don't forget, please.
Okay. You're welcome. You're
Thank
welcome, guys. Okay, bye.